Hi everyone, I'm Stuart Mackay-Thomas. I'm a GP in Camden and I'm chairing the Camden Community MDM for post-COVID syndrome, and I help support the clinical leads, general practitioners in Barnet, Enfield and Haringey. I'd like to give you a brief presentation about how to use the EMIS template to help you refer patients with post-COVID syndrome. Now, essentially, this is quite a short EMIS template, and there is a minimum requirement of some important areas to rule out serious underlying illness such as PE or cardiomyopathy, which can be caused by acute COVID or sometimes alternative diagnoses to long COVID. To start the referral process and use the EMIS template, go onto your consultations, select Run Template, choose the post-COVID syndrome template, and it might be slightly different. This is an evolving clinical pathway as our clinical knowledge improves, and we have made changes already over the last couple of years to the referral pathway. As I say, the important thing is there is a minimal requirement to rule out red flags, and as you'll see really at the bottom here, there are some investigations and clinical examination which is really important, and the main take-home message is to check them hemodynamically, so check their pulse, check their blood pressure and check their oxygen saturations after either exercise, maybe walking around the waiting room, or a sit to stand test if you can do that. Now, that's the minimum requirement before the referral. There are some blood tests that are on the GP website, and they can be helpful as well. And you may want to do a chest X-ray or Holter monitoring. Do check the GP website, which is updated regularly for the pathway. There are other tabs on this EMIS template which look at various symptoms. Fatigue is a really common one. The respiratory history, and it advises you to do the oxygen saturations. That's all useful here. And there are a number of other tabs that may be helpful to have a look at if you wanted to fill them in. We suggest using the post-COVID self-assessment questionnaire, which is on the GP website and should be available to you. I think it's really helpful for your patient to do their self-assessment because it also comes up with the goals that the patient would like to achieve. For instance, being able to work, being able to become less fatigued or much less breathless. They will be doing that in the assessment clinic in UCLH afterwards, so you don't have to do it, but I find it quite helpful. So essentially you would click through these different screens, and I'll just very quickly do a couple of these. So just to show you what we end up with onward referral. Just save this template here. This will save in your EMIS page, and then will help auto-populate the referral document, which we will talk about later.